Dr. Becky Cooper.
Thank you, Madam Deputy Speaker. Thank you very much. So, first of all, I should say thank you to the Minister for presenting this afternoon, and thank you for allowing me to be on the committee, the Tobacco and Vapes Committee, the Bill Committee. It was an incredibly interesting Bill Committee. There were some different views. There was some robust conversation, and it's always good to listen to different views, I think. But overall, this bill had generally cross-party support, and as the benches opposite have pointed out, it is many of their members that have been campaigning for this bill for a long time. I am a public health consultant. I trained for, I'm trying to think, 10, 15 years to be a public health consultant, and the premise of public health is data and evidence. And so opinions are interesting. Opinions can have great colour to a conversation. Opinions can have great characters. But data and evidence in public health will ultimately deliver better population health outcomes.
Suffering and dying.
And this public health bill is a public health bill that will stop people dying and will take away the addictive nature of a substance that is not a choice. Public health has been subject to conversations around should we or shouldn't we impose things for many years. This conversation is not new. Seatbelts. I wonder how many of us in the House feel strongly these days about wearing seatbelts or not. It is perhaps a moot point these days, but you don't have to go too far back to find people who really objected to being told to wear seatbelts. Tobacco is undoubtedly still the leading cause of premature death and disability in the United Kingdom. As has been said by my honourable friends here, every day around 160 people are diagnosed with cancer caused by smoking, and smoking causes at least 16 different types of cancer. I would like to talk primarily around the amendment proposed by my honourable friend for the City of Durham, New Clause 13. Because alongside the outstanding work that this bill will do in enabling a smoke-free generation, we do need to continue to tackle the health inequalities for existing smokers. Smoking is harmful, and differences in smoking prevalence across the population translate into major differences in death rates and illness. One of the roles of this place is that in coming together from all across the country, we represent different constituencies. And in doing so, we want to make sure that we achieve the best health outcomes, among many other things, for our residents. And therefore, it is incumbent on us to look at inequalities and where they reside, and in this place to legislate against those where it is possible. Smoking is the single largest driver of health inequalities in England. It's far more common among people with lower incomes, and we can discuss why that is. I'm happy to discuss that with any members who would like to. The more disadvantaged someone is, the more likely they are to smoke and to suffer from smoking-related disease and premature death. And smoking-related health inequalities are not restricted to socio-economic status. We all represent different parts of the United Kingdom. The poorer health of people in the north of England compared to the south is in part due to higher rates of smoking in the north. And smoking rates are also higher among people with a mental health condition, people in contact with the criminal justice system, looked after children, and LGBT people. We all have different types of people in our constituencies, and we should be mindful of those inequalities and addressing them. Health inequalities will be reduced through measures that have a greater effect on smokers in higher prevalence groups. And in practice, this means both prioritising population-level interventions, which disadvantaged smokers are more sensitive to, and targeting interventions on these smokers. As someone who has run smoking cessation services during my time as a public health consultant, I can absolutely say that it is an incredibly difficult thing for anybody to give up smoking. And I actually think that we do have members who have succeeded or perhaps are still trying to do so. To give up smoking, you need to be in a place where you have mental resilience, where you are able to put time and energy into quitting smoking. If you are fighting all the other issues that come with the burdens of being poorer, fighting for employment, looking to feed your children, it is so much harder. My honourable friend, the member for the City of Durham, has proposed a roadmap to a smoke-free country, which would report to this place every 5 years. I am not particularly wedded to whether that is the case or that isn't the case, but I do think that we should ensure that we are laser focused on reducing health inequalities across all our populations, and I hope therefore that our government will consider on a reporting process similar to this one as part of the National Health Service changes that we all know are going on at the moment. In the Health Select Committee this morning, we were talking about where the Office for Health Improvement and Disparities will go with the dissolution of NHS England. I think this is an ongoing conversation that we need to be very mindful of. So we need to ensure that the ongoing importance of addressing these health disparities are not lost, and I think they are front and foremost of the Secretary of State's agenda in the 10-year plan. And I very much commend this bill to the House. On behalf of public health consultants, the public health professionals, I'm so proud to be part of a government, to be part of a parliament that will bring this life-changing legislation to this country. Thank you very much.
Yeah. Sir John Hayes.
Thank you, Madam Speaker. In our post-spiritual, or at least post-religious age, two phenomena are evident. When God is forgotten and faith declines, it's not that people believe in nothing. As G. Case Chesterton said, they believe in anything. And they find new causes and crusades. And the advocates of this bill, I know, believe they're crusading in a noble cause. The second thing that occurs is, as demons are regarded as purely mythical entities, things that were once regarded as normal, as regular, become demonized. And so the curious paradox is that whilst cocaine is widely available, and I am told de rigueur amongst certain elements of the urban liberal elite, pipe smokers are now seen as heretics. And if this wasn't so alarming with the subject of comic satire, that's the kind of world we live in. We are simultaneously becoming more prurient and more puritanical. Now, the amendments that stand in my name and in those of other honourable and right honourable gentlemen are designed to improve this bill, to avoid the unintended consequences. The honourable lady from Worthing West said, and I think I'm quoting her accurately, she said, we need data and evidence. And what's clear from the data and evidence is that previous attempts to deal with the issue of smoking have resulted in a huge surge in illegal tobacco. Yeah. 83% of smokers report purchasing tobacco not subject to UK tax in 2024. That number has increased hugely since that earlier legislation. 3/4 of smokers claim to buy tobacco not subject to UK tax from under-the-counter suppliers who have become legion in constituencies like mine, and I'm sure in small towns across the whole of the country. Those are the unintended consequences of well-meaning crusaders who thought they were doing noble things when they passed legislation in this House. That is the data. Those are the facts. I will give way, because as I've cited the Honourable Lady, how could I do anything other?
Thank the Honourable Member for giving way. Is the Honourable Member therefore making the argument that we should not address population health issues, which our population health interventions in this area have seen a reduction in smoking, a reduction in health-related damage from smoking, because the consequences of illegal tobacco then need to be addressed? Is he simply saying that we should not try and address the illegal issues and we should keep it legal and therefore not see a reduction? Thank you.
What I'm saying to the Honourable Lady is that the government, and the last government should have done the same, need to take concerted and decisive action to deal with the unintended consequence of well-meaning legislation that led to a huge growth in the illegal sale of tobacco and cigarettes. And rather than introduce a rolling age of consent, which is entirely unenforceable, by the way, they ought to target their efforts, draw on their resources, seek the expertise which is available to government almost limitlessly to deal with an issue which, frankly, is going largely unrestricted. Good work is being done by Trading Standards in my own constituency in Lincolnshire and by local police, but they struggle because the legislation is inadequate. I personally would have supported the bill had it come to this House, and I won't digress too much, Madam Deputy Speaker, because you won't allow me to do so. I would have supported a bill that perhaps licensed the sale of tobacco. And most tobacconists, most newsagents, I suspect, would have welcomed it, actually. And I know police would like to see that kind of measure, rather as we do with alcohol. There's a precedent there. But that's not what is before us today. We have this rolling age of consent. And Amendment 4, standing in the name of the member for East Antrim, tackles that issue, because he's right. You cannot enforce a rolling age of consent. I'm in favour, by the way, of raising the age of consent. I'm in favour of raising the age of consent for virtually everything, to be quite honest, to 21. And that could be enforced. It wouldn't be straightforward, but it could be enforced. But the idea, the nonsense of someone going into a tobacconist or a newsagent and saying, I'm 29, and the tobacconist saying, actually, I think you could be 28. Or in years to come, I'm 57. And the tobacconist or newsagent saying, no, I think you could be 55. This is never going to happen. No retailer is going to do that. And so either the bill will fail, the law will be broken regularly, daily, for I think that is what would happen, or we're going to devote undue resources to policing something that frankly doesn't warrant that kind of attention. So let's recognise that this is a preposterous proposal, and as the member for East Antrim said, we shouldn't do things in this House by and large that are preposterous, and I happily give way to the honourable gentleman who's going to tell me why we should.